Right, good morning, everybody. Welcome to the Complete COVID-19 and Compassion webinar. We will be joined by Alan any second, but I just wanted to let you know the format of this webinar will be probably about 20 minutes of Alan sharing his thoughts about how we can all not just survive but thrive in this interesting time in our planet's history. For those of you who don't know me, my background is that I'm a senior practitioner with Complete Coherence and one of Alan's colleagues, and work with clients to deliver our complete service. But I used to be a political reporter for a TV company back in the 80s, and this feels strangely familiar to me to be broadcasting to people that I can't see down a camera lens. Also, Alan has written a number of different articles and is hoping to share with you some of the links to those articles and explain why he's sharing those particular links. And we're delighted to see Dr. Alan Watkins on the other camera. Welcome, Alan. I've been covering for you in true journalistic style, but we'd like to hear you. And we have 78 guests on the line waiting to hear you. So I will shut up now and let you get on with your webinar.
Okay, so good morning, everybody. I wanted to do two things, which is essentially run through some of the things that you're not getting told by the media and share some perspectives which might help you this morning. First of all, I feel compelled to speak because, ironically, I've got a medical degree, a PhD in immunology and a degree in psychology. So it's almost a perfect triangulation of those three problems that we're leaning into. So the first thing I wanted to say is there's no doubt that we're facing what's called a wicked problem. And wicked is a technical term. It doesn't mean wicked in the sense of evil. It means super complicated. And I wrote a book some time ago called Wicked and Wise, which is how do we really deal with these wicked issues, and there are many, many of them. Last year, many of us experienced the sort of Extinction Rebellion debate, in relation to climate change or accelerating climate problems. That is a wicked issue. Brexit and the whole political regression that's going on globally, it's another wicked issue. We had many problems as a result of those two things, and we also saw the fires in Australia, the flooding in the UK and Indonesia, and so the world, as it accelerates and speeds up problems created by society, there are a number of these wicked issues. And as we pointed out in the book, all wicked issues have 6 dimensions. Number one, they are multi-dimensional, and I'll come back to that in a moment. They have multiple causes, multiple symptoms. They affect multiple stakeholders. The answer to these problems, it needs multiple solutions. There isn't a one single answer that fits all of these wicked issues. And most problematic is it's constantly evolving. And that's particularly true of COVID. The position is evolving on a daily basis, country by country. And you'll see in the link, hopefully, there's a link to that Wicked and Wise book if you want to understand the complexity of these types of problems, because once we get past COVID, there will be others we will be facing every single year. First of all, if we take that last dimension first, the constantly evolving, there are basically 5 waves to this COVID pandemic. The first wave, which we're right in the thick of, is the viral infection itself, which predominantly is a medical, immunological and psychological issue. So we've seen some of the psychological impact across UK society and globally. But the problem is, in its first instance, the treatment of the virus itself. So the second wave, and I'll come into some more detail in a moment about treatment and what we need to do as human beings and so on. So the first wave is the sort of medical side of it. The second wave is that as any particular nation reaches peak infectivity, there's a risk of significant overwhelm of a healthcare system. Doesn't matter how good your healthcare system is, they can be overwhelmed. And mainly what that's about, as many of you will have seen, is do we have enough ventilators for the people who have a very severe infection? Because it's viral, you can't treat it with antibiotics. So when you have a very severe infection, you need ventilating to treat the acute respiratory distress syndrome or pneumonia. So that's driving that risk of healthcare overwhelm, is driving pretty much the UK government, many other governments' response. And again, we'll come back to that in a moment. The response is pretty narrow in sense that everybody's focused on the death rate. Now, of course, we must try and minimize the number of deaths. That's a sort of given. But it's not the only problem that we're facing, as with all these wicked problems. If you see the problem too narrowly, it's going to possibly perpetuate problems and create further problems down the road. But we're taking a very narrow view of suffering, that the only type of suffering is suffering that results from death within the population. But as many people have started to twig, there's a potential huge wave of mental health issues that's going to kick off through self-isolation or the fear or the anxiety or the panic or the worry, not just in relation to the health dimensions to this, but in the relation to the economic dimensions. So just taking the potential death rate in society is not the only thing we should be thinking about. There's a much bigger suffering going on here beyond just the possibility of death. We should, of course, do everything we can to reduce death, but it's not the only issue that we need to think about. I'd also say in this second wave of the healthcare overwhelm is that the anxiety that is driving some of the thinking around this is being amplified unhelpfully by many media sources and social media sources. So that's making it more problematic. And actually, what this really says is, in this sort of healthcare overwhelm wave, we'll need to reassure repeatedly workforces and the general public. Repeated reassurance is going to be required. The third wave, as we're already beginning to see, is the economic impact. And we're already seeing pretty much every business on the planet is being affected by the economic impact. Certain industries are more at risk than others of will they even survive this crisis. But all companies, large and small, are going to be in difficulty. And the ones that are going to be in the most difficulty are those that are already carrying high levels of debt with very low levels of reserve. So they'll be particularly distressed, even if they're in an industry that is not directly impacted, like the entertainment industry, where all restaurants and bars and hospitality industry, they're shut down pretty quickly. So being agile in the face of that economic threat is unbelievably critical. So that's wave 3, the economic impact. Wave 4 is beyond the virus. There may be some systemic changes. So if we pull back for a moment and look at what happened in the global financial crisis of 2008, by the way, a previous wicked problem, there was much hope that that crisis was so intense and, basically doubled America's debt in a year, caused 30 million people to be unemployed in a year. There was a lot of hope that that global financial crisis would wake the world up to some of the ways that we were conducting ourselves. But sadly, it seems to have not made much of a difference. And so hopefully COVID will be different, that it will trigger some much more mature thinking about global systems, whether it's global healthcare systems, global financial systems, global economic systems, communication systems around the globe, social networks, media outlets. There'll be certain definite implications for the future of work and employment. What's this going to do to change the way that we see certain members of the workforce, healthcare workers, drivers, people who've been traditionally somewhat undervalued and seen, what might be called at the bottom of the pyramid. Maybe society's view will change. Maybe we'll change our view about the inequality and how we reward certain jobs. It may affect our view of national boundaries even, or our need to travel for work as we all learn to work more effectively in the virtual world. So these are all the systemic changes in wave 4, and wave 5 are all the unintended consequences that flow from all those systemic changes. So, for example, there's been some interesting noise on the internet about people in China seeing a starry sky for the first time in years as a result of the reduction in pollution. That was an unintended consequence, as people didn't expect to see that. So we'll have to plan for the unintended consequences, which is quite interesting itself, because how do you plan for something that was not intended? So that's the fifth wave. So there are 5 waves to this pandemic, and we're really in the thick of the first 3 waves: the medical, the healthcare overwhelm, and the economic impact. So picking up the idea of wicked issues, if we come back to the first sort of dimension of wicked issues is the fact that it is multidimensional. And what we mean by that is it affects what we're doing as human beings, it affects how we are as human beings, and it affects how we relate to each other. So I want to just pick those 3 dimensions up because pretty much everything we've heard so far from most of the governments is focused entirely in the doing world. You know, what is it that we need to do? So, like wash our hands, social distancing, and so on. So a lot of the advice has been in the it world of doing, but very little advice in the I world of being. Now, one of the reasons I feel compelled to speak is that nobody's offering people individual advice. Well, how do I personally cope with the anxiety and the stress and the worry and the concern? And we need to lean into that because the more anxious and worried I feel as a human being, the more I increase the stress hormone cortisol in my body. The more I increase cortisol, the more likely it is for me to become infected. And if I have a high cortisol, that infection will be more severe. The amount of virus replication in my system will be greater, and the more likely I am to infect others. So the more I become worried and concerned, then the worse the problem gets. So it's beholden on all of us to actually develop much greater resilience and the ability to regulate our own emotions. And so the first port of call when you're in a crisis, as we would advise all of our clients, is before you do anything, manage your own emotion. That's the first step in any situation of difficulty. Manage your own emotion, because for 2 reasons. Number one, if your emotion becomes turbulent, panic, anxiety, worry, stress, overwhelm, if you're feeling those feelings, that it impairs your brain function and you can't think straight. And if you can't think straight, you'll make decisions that are counterproductive and unhelpful to yourself and others. So the first port of call is to manage your emotional response. And the second reason, not only in terms of clear thinking, is it actually improves your immunity. So if you can shift your emotion to a more optimistic, positive state of appreciation. So for example, appreciating the fact that there are many healthcare workers on the front line, there are many drivers still out there trying to keep society going, there are many pharmacists, there are many delivery people, there are many people out there trying to help us through. So rather than overwhelm and worry and stress ourselves, if we can shift ourselves into a state of appreciation for that, that will have positive biological consequences for ourselves and our own immune system. So we have to practice being more appreciative and being more resolute and more optimistic, even in the most dire circumstances. It's unbelievably important to ourselves, to our families, and to the wider community. So maybe humanity will learn the criticality of emotional regulation as it comes through this crisis. The second thing in terms of the individual is I wanted to make some points about quarantining and self-isolation, because there's the whole strategy of most governments is predicated on avoiding the overwhelm of death rates and the overwhelm of the healthcare system. Now, what we're not debating is maybe we should just quarantine all of those at risk. And if you look at the stats globally, and there's a very good link in the chat for the global stats, if you want to know what's going on literally country by country, there's a COVID stats link. So it's clear that the children are particularly mild infection in children. And it's really the over 80s that are most at risk and the people with pre-existing disease. So we absolutely should quarantine those people and even take a view on the people between 70 and 80. But people under 70, if they've got no pre-existing disease, if they're not disabled, if they're not, there's not another medical reason, it's most likely that these people will have a relatively mild infection. So one of the perspectives I've seen emerge on the internet is a debate about whether we should create something that's been called herd immunity, or increasing the resistance in the entire community. So maybe those people who will experience a mild infection should develop the antibodies, and we create this herd immunity. And if we add testing of as many people as possible and protecting the vulnerable, that's another way of maybe bringing this whole crisis to a much more abrupt end. Whereas what we seem to be doing right now is trying to, as it's been said, flatten the peak. But the consequences of that is that we extend the problem for more months, and not just the health problem, the health overwhelm problem, but also the economic problem. So we're not really having much of a debate about, is that the only way of approaching this? You know, the whole notion of herd immunity rose initially in the community and then has sort of been jettisoned, and we've all piled in on this one gamble about just healthcare overwhelm is the only thing that matters. So I think we need a wider debate about that. Is maybe, you know, we need to revisit sort of what's called graded exposure to people who almost certainly will have a mild infection and come through, raise antibodies, and therefore be less risk. Because the most dangerous thing is people wandering around infected who don't know they're infected. So there's a wider debate that we need about this self-isolating and quarantining, which just isn't happening. So that's some of the things in terms of us as individuals. And then in terms of the IT world and some of the strategies for healthcare systems is out the other side of this, we actually need to have a much more sophisticated debate about healthcare systems globally and how they're set up, how they're resourced, and how they're led. A part of the difficulty in the UK, certainly with the NHS, is you can't have that debate because it's a political nightmare. So anybody even starting to raise some questions about how we reform or transform the NHS is branded some sort of bad person, you know, because they seem to be bashing the NHS. Whereas actually there's many people who've got lots of great ideas about how we evolve the NHS or how we evolve any healthcare system. So we need to have a debate about that. I've been asked questions about the use of retired doctors and nurses coming back in, and if it's the elderly who are more at risk, isn't it a bad thing to bring back elderly medical practitioners back into the service? And I think the answer to that is it depends on, you know, whether they've got pre-existing conditions and how old they are. So there are many retired people who might be in their 50s, which I think is pretty safe. And it also depends on whether they're frontline or backfilling. So I think we have to take a nuanced view about those people returning to the workforce. And then finally, and then I'll stop in a minute and we'll maybe take some questions, is one of the consequences, we're already seeing that, and it's been well promoted in the media, is about the sort of social connectivity. You know, people in streets where they'd never talked to their neighbours for 20 years, suddenly everybody's on a WhatsApp group. And it's been marvellous to see humanity's resilience as a community, as people reach out to each other, you know, do virtual classes for each other, things free of charge. But there's no doubt, hopefully this will make us reconsider how we're connecting to each other, and you know, what that really means. And as we've been encouraging certainly the corporate clients to accelerate into this virtual world. There's an awful lot you can do when you get good at virtual communications, assuming the tech works, to actually have more disciplined conversations, be more respectful of each other's time, and get to the heart of the issue much faster if we learn to communicate and have more meaningful connections, either over the internet. I mean, certainly myself and my wife and our kids had a virtual Sunday lunch last Sunday where we dialed up and we ate together over the internet, as it were. So that's things like that. It could be extremely positive for how we connect in communities, knowing our neighbours better, reaching out and offering help to each other, and connecting. So there are many consequences that might flow of a positive nature in the we space. And then just one final point about what the government has offered in terms of furloughed workers, as it's being called. That really only applies. It's not a blank check for all people who were in employment or who maybe recently been made redundant as a result of this. It largely applies to people under a salary sort of level of about £30,000 a year. So the maximum you can claim 80% of your salary up to a maximum of £2,500. So that's roughly a sort of salary grade of about £30,000. So anybody that was on more than that, this doesn't really apply. And it's largely those people who've been made redundant as a result of this crisis. So this isn't a way of keeping workers in work if they weren't being made redundant. So the details are yet to be ironed out, but it's not the blanket check that many people thought it was. It only applies to a sort of relatively small percentage in most businesses of the workforce. So there's huge economic consequences that we're going to have to work through. And part of the problem, though, is there's no current exit strategy from the current plan. Is we don't know how long this is going to go on for. And so one of the things, hopefully, we might be able to trigger is a debate about is there a different way of approaching this, or is the only way to deal with this is to ignore herd immunity and just isolate everybody to slow it down. So some of that is true. And again, wicked problems, there isn't one single answer. There are multiple symptoms and multiple solutions. So one of the solutions that we need is, of course, quarantining, but it's not the only one. And again, going back to those 6 factors that are true of all wicked issues, it's multidimensional, I-we in it. It has multiple causes in terms of how come this has spread so quickly, and we need to learn about that. It manifests in multiple ways, multiple symptoms, multiple stakeholders. It affects everybody, and everybody's got a different view. And we need multiple solutions, not just one solution. We need multiple solutions, and it's constantly evolving. So if we don't have an exit strategy, the risk is the longer we continue on the current plan, we increase the risk of the virus itself mutating. And if we think this is a bad time right now, if the virus mutates, wave 2 of the virus, if that ever happens, it could be way, way more damaging globally than wave 1 of the virus. So we want to try and get through this as quickly as possible. And that relies on us all managing ourselves and all supporting each other and having a much more nuanced debate about what we really need to do to get through this as fast as possible. So that's probably all I want to say for the moment. And hopefully Pip's gathered some questions from the crowd. Pip.
Yeah. So some really great questions coming through, Alan. And I think one of the most common questions is, it's really, you've talked a lot about the theory and the approach of managing your own emotional state. But I think people would find it really useful to understand what are the pragmatic approaches to managing your emotions.
Right, and so there's 2 books that we've written about this, and again, they're in the chat, Coherence and 4D Leadership. So these books were predominantly written for leaders in business, but they're stacked full of real sort of pragmatic advice that anybody, frankly, can use about how you regulate your emotion. And it's sort of interesting as a society that we're having to teach this to people in their 40s, 50s and 60s, because this was not taught at school. None of us got taught this at school. We got taught maths and English and geography and all those things. But one of the things that's only really in the last 10 years even being thought about to any extent is teaching human beings to regulate their emotions. And it's an unbelievable critical life skill. So just very quickly, if you don't want to read the book, is it starts by regulating your breathing. And that starts with not deep breathing. Deep breathing isn't that actually that helpful in a crisis. What you want is rhythmic, even breathing. So to breathe rhythmically, evenly, and through the center of the chest is the technique that we teach. And that will stabilize your biology. It creates what we call a coherent state. Once you've stabilized your biology, then there's a slightly bigger task, which is getting the ability to change the emotion that you may be feeling. And the essence of that is that takes time and practice. You actually have to change your emotion. Now, the good news about that is human beings change their emotions all the time. They just don't do it on purpose. So when the sunshine comes out, for example, we feel better. So notice that and see if you can feel better even if the sunshine hasn't come out. And that requires you to practice shifting to a more positive, upbeat state just to see if you can. And so we really encourage people, just see if you can shift. Just see if you can turn on a state of appreciation. Appreciate the fact that your fingers of your hand, for most people, are a marvelous thing. They work. You've got sensory capability. The unbelievable beauty that nature has given you of your eyeball, if you can see. It's amazing that you have an eyeball that actually can see the world. And being in deep appreciation for your own immune system, the fact that your immune system for most human beings will fight off this virus easily. So be in appreciation for that. So it's a practice. We are what we practice. So we need to cultivate that ability to practice more positive emotions more of the time.
Thank you, Alan. Really, really helpful. And can you just build a little, somebody's asking if you could build a little on your point about people needing reassurance. So you've made the point about people managing their own emotions, but we all need a little reassurance from those around us at these points, particularly when we're self-isolating. What is it that leaders could be doing at this point, and what's most critical for them to be spending their time doing?
Well, again, the first step in any crisis is to manage your own emotions. And that's really true of the people we look to for leadership. So leaders need to be, even-tempered in times of crisis. If we look to our leaders and they look jittery and panicked and worried and freaked out, that is not helpful. So the leaders themselves, more than pretty much anybody, need to be even-tempered and not to panic and not to look worried. So they themselves have to manage their emotional, because if they can be, more resolute, determined, and optimistic in this crisis, and resourceful, any of those types of emotional states, emotions are contagious. So we can literally positively infect, so forgive the pun, we can positively infect each other with positive emotions. Just as people who've got no ability to regulate emotions can freak each other out and panic each other, that's not helpful to anybody. On the positive side, if we remain calm and steady and upbeat, we can create a positive infection, and that has helpful biological consequences. It increases our DHEA, the hormone that's the body's antidote to cortisol. It has a real biological benefit to us in increasing our resilience against a viral infection. So leaders need to be positive and upbeat, and they need to encourage their workforce. So constant reassurance from leaders to say, look, we will come through this. It's just that this generation hasn't experienced this type of crisis ever. And so you can only go back to the generation that lived through the war, where they had no exit strategy. There was no end in sight for 5 years. So COVID won't last that long. There are other human beings on the planet who've been through worse than this. Yeah. Human beings are incredibly resourceful. We can get through this, but we need to, wake up and grow up and mature and be much more considered in how we respond, and take, if we can control our response, if we're able to respond in a more positive way, then we're effectively response able. So to be responsible as a leader, we need to be able to respond in a more constructive fashion. That's what being response able really means.
Mm. And so you've talked about managing your emotions, but it's a practice, isn't it? Right? It doesn't happen just overnight. You have to put some work in.
And anybody that encounters other people, this is a daily practice. So, even in our business, and we consider ourselves, we don't call ourselves coaches, we consider ourselves practitioners, because we're practicing all the time. And the great news is we're in relationship with each other. Human beings are social animals. We actually need each other, which is why it's very interesting and important when we're socially isolated, is to constantly connect in the virtual space as much as possible. And we have to constantly practice until we get really good at this stuff. And it is possible to face any sort of crisis with a degree of equanimity, but only if you practice. If you don't practice, then the first time there's a crisis, you panic, you flip out, and that's not good for your mental health. That creates more cortisol. It gives you a vicious cycle and a downward spiral. So we have to develop a daily practice, and society would be a whole lot better if everybody actually, in addition to practicing their yoga or they're going for the run or all that, is actually deliberately practiced emotional regulation. Society would be very different if we all did that.
And how we're all connecting via this webinar, and people can see you and they can see me, but in the working day in this world of isolation, how are we going to create the real connections that will help us to be able to boost our emotional state and to boost our sense of feeling that connection that is very healthy for individuals and teams?
Right. Well, I'd say two things about that, which is, first of all, there isn't a one-size-fits-all in every country on the planet. So, the WHO has not yet released regional strategies, because the strategy for the UK and for Europe, which is where the pandemic is at its peak right now, is very different from the strategy for Africa. Because if you live in a slum in Johannesburg, you can't socially isolate. It's not even possible. So it's nonsense to even suggest that. And actually, because the death rate is much higher in the elderly, well, in Africa, I think the percentage of the population that's over 70 is 6%, 0.6%. So actually, it's probably not even necessary to socially isolate in parts of Africa. Not only is it not possible, but it's probably not even appropriate. Of course, there's a huge potential risk if you did that in Africa of making poverty even worse. I was talking to some people in Mexico yesterday, and they said 50% of the population in Mexico is in poverty. So we need a much more nuanced approach. Certainly in Europe, where we're a bit better off, as we're socially isolated, those that can need to connect virtually. But it's not just a question of connecting virtually. What matters for your health and well-being, emotional well-being, as well as physical well-being, is connecting in a meaningful way. So not just tittle-tattling and panicking each other on the internet and trolling each other. As Caroline pointed out, sadly, before her demise, is we need to be kind. Connect in a kind and meaningful fashion. Let's have some compassion for each other. But those that can't or haven't got the technology to connect in a virtual environment, fortunately, many people have got mobile phones, so they can connect, is just reaching out in whatever way you can with your neighbors. If you haven't got a computer and you can't do a Zoom conversation like this with video, maybe you've got a phone, and most people, even in poor countries, have phones. Whether it's a WhatsApp group, and just sharing messages of encouragement and support and kindness to each other goes a long way. It has a biological consequence. These things are important to us. We're social animals, and the benefit of this connection is it does make us feel more positive, which has a biological benefit.
And sort of coming to the last few questions, because very conscious of time, but one of our guests has asked if employers should set up a helpline, for example, for people to call into. Would that work, do you think?
Well, it depends. We're more than happily as a company to offer our help and advice to personalize, messages for certain companies. So do feel free to email us and reach out to us, and we'll do what we can to help. Because in terms of helplines, those things only really help if you've got quality advice, well-informed advice about what's going on, why it's going on. And as I said, these things are super complicated. So it's very easy to set up some well-intentioned helplines or support, which actually are making things worse. They're either giving out inadvertently the wrong information, or a slightly misunderstood perspective, or not emphasizing the right things. So now, if those helplines are staffed with people who are very well informed, who do understand the complexity of this, and who aren't just trotting out the party line. And again, don't assume that everything you hear is actually correct. I mean, one of the things that's been very interesting, and we live in a world of fake news, is there's been a diminution or reduction in the fakeness of the news of late. But there's still an awful lot of misinformation out there. The myths around COVID, for example, the fact that, we're going to have a vaccine. Well, we're not going to have a vaccine, for 12 months. It's just not possible. There are treatments out there. My ex-professor, Stephen Holgate, has got a Synergen company that is trialing right now a treatment for COVID in some NHS hospitals. You don't hear that on the news, but it's critically important. So if we accelerated the scale up of that, it may be a game changer, but you just don't hear these things. So if you can have an employee helpline, it depends who the helpline staffed by, and whether it will be actually that helpful to the employee base.
Okay, thank you. Well, thank you very much, Alan. We have overrun, but we did start late, so thank you for sharing your thoughts with us. I think it would be also good to sort of ask all of our guests who joined us this morning if you would find more of these webinars helpful. We have a lot more to share with you in terms of how to manage the I and the we in these very challenging times. So we are exploring providing webinars and podcasts on a more regular basis. If you would find those useful, and if you would like to suggest some of the topics that you would like us to cover, please do get in touch. We can be in touch with you, as Alan has said, to support you in any way that we can. But thank you for joining this morning. Thank you, Alan, for your thoughts and your wisdom. And we wish you all a very good day. Stay safe and healthy.
Goodbye.